Hi, I'm Hannah Crymble and welcome to Staff Nursing. I got into nursing not really the way you would, it wasn't like school and university and then nursing. I left school in lower sixth, so I didn't have any A-levels or anything, and I was coaching gymnastics for a while, and it just kind of dawned on me that I didn't want to be a gymnastics coach for the rest of my life. So I was just looking to think of what I wanted to do, and it was between being a primary school teacher and a nurse.
Okay.
For no real reason. They were just sort of jobs that I thought I would enjoy. And then I decided on being a nurse, so I looked into how I could get there, because obviously I didn't have A-levels, so I couldn't just go apply for a nursing degree. So it turns out there was it's called an access course, I think, that you can do through the colleges, because I'd been out of long-term education for however many years it needed to be. So I did that, fast-tracked it for a year, and then went to Queen's and finished my degree and started working.
So what made you choose the nurse over the primary school
I
teacher?
really don't know. I just was leaning more towards it. I don't know, I have had a few experiences before it with family members and my friends' family members not being well, and sort of just, I think I've just always naturally had that caring sort of side of me maybe. But there was no, the way some people have a big story about it, or there's not many nurses in my family or anything like that. It was just something within me that was telling me I think I would be good at this job, and
You made the right choice.
hopefully, yeah. I think so.
I always wanted to be a nurse, and my dad tried to make me be a physiotherapist, but I didn't want to do that, so I always wanted to be a nurse. And back in my day, you didn't need A-levels. So I went to college, and it was the best time of my life, and haven't looked back.
No.
Haven't looked back since. Working most of the time in care of the elderly, and it's just so rewarding. You know, you just become an expert in the elderly, because they're just so quirky, and
Yeah.
yeah, they've all got their own personalities, so yeah.
No, but it's good, because I think you need caring people out there who are going to be advocates for the elderly.
Yeah.
Especially when they can't make those choices and things themselves. It's really, really important to have those types of people in. So you work in the cancer?
Yes. Yeah.
What took you there?
Throughout university, I always said I wanted, I was always dying for a cancer placement. I always wanted, and I was lucky enough I got 2 placements within the oncology side of cancer and nursing and whatnot. So I don't really know, again, why. I was just always drawn to it. And I've never looked back. I've done a few, bank shifts in different wards, and they're not the same to me at all. Yeah, oncology is definitely where I think I will stay forever, I could imagine. I love the patients, I love the nursing, I love the families. I just love all of it, the good sides and the bad and sad sides of it. I get a lot of, I don't know, accomplishment from it, I guess. Yeah.
I suppose it's very close.
Yeah,
to
the families,
as well.
we grew very close to the families, we really did, and it's just so rewarding, it really is.
Yeah.
For me, it's, obviously my position has changed as nurse manager at agency, but it's rewarding for me to be able to send staff out and know that they are well trained and are empowered to do a good job of caring. Not everybody can be a nurse.
Yeah.
You have to have something in your heart. It's not something you do for the money.
And I think it's the same for healthcare assistants as well, isn't it? It's not just a job that, if you just want to make money, there's other things to do. You're not going to become rich working in healthcare. It's not for that reason that you do that. It's because it's in you.
Yeah. I think for me, it's just I'm meeting my patients on one of the worst days of their lives, or the hardest period of their lives. Their families are going through something devastating. So just being able to make it a wee bit easier for them, be that shoulder for them to lean on, help guide them through something that most people would find unimaginable to even think about. So I think just when I know, like I said, family members came back up to me and like they're just saying thank you, like I don't know how we would have done that without you.
Yeah.
Or like just seeing a patient just trying to be like, thank you for helping me through that. Or if you see maybe their symptoms ease because of something you've done and you've just made it just that wee bit easier for them, like I really like that side of it.
A sense of satisfaction.
Yeah. There's definitely days in my job where it's really difficult, whereas I could have patients who are maybe the same age as my parents, who then have a daughter who's the same age as me. So then I'm trying to help her deal with potentially losing, say, her mum, and then I'm trying to like empathise with her, and then that gets very difficult because I couldn't even imagine going through that, like losing my mum. And you know, it is very easy to like take that with you. Where I work, we're very good at like, we can set up meetings and that where we can, let's say we've all been through maybe the same traumatic, I guess you could say, loss or shift or whatever it may be. My manager's very good at setting up, like we can all discuss it and you know, what went well, what didn't, what help you may need or whatever it may be. So we're very good at that. Also then, obviously with my weightlifting, that's a very big, you know, clear head. Yeah, really clears my head. I can really leave work at the door of the gym, I guess. My coach is very good at like, he'll always be checking in, how was your shift, well, X, Y, and Z. He'll know what type of training I maybe need or don't need after a particularly hard shift. So I do have different wee things set up that help me, but there are times where it is just a lot, and sometimes you just need to have a good cry in the car on the way home, and like that's okay. That doesn't make you any less of a nurse or a person. Sometimes, you know, we're all human and you can get
I think
bored.
in my career I've cried loads.
Do that. It makes you less of a human.
I think for me, because I think about this all the time when I'm in work, we can go through periods where we're having a lot of like medical emergencies or whatever it may be, and I'll be thinking, oh thank goodness I did that XY like training before and whatnot, or if it's happened I'm like, I need to get booked onto this training for an update, because you never know when something is going to happen. So you might think, I don't know, like your in-house life support training, for example, you may have been very lucky and never dealt with a cardiac arrest or an emergency of that kind, but if you aren't keeping up to date with that training, like there could be a day you're the first person there, and if you don't know what to do, like the results of that to that patient is life or death, really. But that's a very extreme example. Even like little things like we would do like dysphagia training and that, and so if you're not up to date with that, you could end up again really harming a patient, maybe trying to feed them something they really shouldn't be eating, for example. Like, so goes from one extreme to the other, but you really do need to keep your training up to date.
I mean, as an agency, we're really, really proud that we give all our staff in-house training from trainers. And every year, you know, something can change. It's keeping your skills and knowledge updated so that you can use them, you know. I've just gone blank.
We've even had some, you know, nurses or healthcare assistants who've been involved in resuscitating, you know, service users or residents who have, you know, gone into some sort of cardiac arrest or something like that. So, you know, just being refreshed in their basic life support, first aid skills, things like that, you know, it really, it's a very positive impact, you know, and it's a traumatic experience to go through that, but, you know, if you don't have, you know, enough training and experience and confidence to do that, then you're not going to be able to help anybody. So, yeah, it's really important.
And an important one personally for me is my moving and handling one, because obviously with my training, like the last thing I want to be doing is going into work, helping a patient mobilise to say the bathroom, but I do it wrong and I end up hurting myself. That's now having an impact not only on the way I'm caring for my patient, the safety for them, but then like outside of work, my training, I know I have to go text my coach and be like, I've just hurt my back, and that could all be down because maybe I wasn't up to date my moving and handling. I maybe didn't do it the way I should have been doing it, using the equipment that was there for me to use, because I just was unaware and thought maybe I knew better.
Yeah, that happens though, doesn't it?
Yeah.
And that's that's what we say to our agency members, just to keep, you know, make sure you do it the right way. Because you can hurt yourselves and others. Yeah, definitely.
I think think empathy is a very big one, especially in my line of work. Like, what my patients and families are going through are, like, I actually just can't even personally imagine it, to be honest. And like, sometimes you'll get the families or the patients and they may like lash out at you, like you're getting them in a very tough time in their life, and they may say and act in the way that they maybe wouldn't normally do. So it's important that you can really empathise with them and not take it personally and be like, I understand you're going through a really difficult time, this is what I can do to help. Sometimes it's saying absolutely nothing and just giving them space, and you know, even just like saying to them like, this is crap, you know, like just to say to them like, you know, it's not fair, and just let them have a cry, let them lash out if they want to. Like, I do think empathy's, if you can't empathise with people, you may just think that's like,
Absolutely.
you might just say the wrong thing to them, maybe tell them, you know, you're acting really out of order, or you could be dramatic. Like, that's probably one of the worst things you could maybe say to somebody going through something like that. So empathy, I think, is a good one. Patience and team working, and like, you need to be able to work as a team as a nurse. You can't go
100%.
into it thinking you can do it all on your own, because you can't.
No, you have to
Not
depend
even,
on each other.
yeah, not even on a nice, slow, easy shift. It's still too much work for one person. You just cannot do it. So you need to be able to ask for help, but also be willing to help others as well. Like, not just focus on your own.
You do need it to be like a team, like your work family. That you can depend on each other. You can support each other through difficult times and things that you're going through.
It is a hard one, isn't it?
Because you don't want to sound too negative and just say, like, you don't come into nursing for
It
the
is hard
money
work.
in that, because that can obviously put people off and think, well, why would I want a job that I'm not going to get overly paid for?
But it's a terribly hard job.
Yeah.
But when you have done something, even something really small, and you can sit back and say, you know what, I made a difference to somebody's life today.
Yeah.
You know, that gives me that.
Yeah. But even whenever you just engage with someone, and maybe someone who doesn't get a lot of visitors, and you've, you know, had a conversation with them, and you've seen them light up in their eyes, and, you know, even small things like that would give you the satisfaction.
Definitely, yeah.
But I would encourage people of that age maybe to try and get out and do a bit of voluntary and work with people to try and see whether this is for them. You know, and you can see both sides of it.
Same. I would always encourage anyone who wants to be a nurse to go into the role. Like, I absolutely love being a nurse. Like, the pros outweigh the cons for me 100 times over. Like, it would be very easy for me when I started my weightlifting to go get a different job that works a lot easier with the training side of things. But I thought about it. I did think about temporarily stepping away from the career and working in a gym, or like even like a coffee shop or something, but I couldn't. I just love the job.
It doesn't fulfill you the same.
I just love it far too much, so I just decided to try and make both work, and
side by side.
thankfully it's working out okay at the minute. So.
Glad to hear it.
Anna, how did you get into the weightlifting?
Well, I come from a very fit and active family. Both my parents are heavily involved in sports throughout their childhoods, and they brought that through into their adult lives. So me and my sisters, we were always brought up, you know, being involved in a sport was normal. Like, it was weird if you didn't do something, you know. So it's always been my normal to go to school and then whatever sport you were doing that day. So the sport that I kind of fell into and started doing very long term was gymnastics. I was a gymnast from the age of 7 to 17, and I did that quite competitive. I was very average at best, but I was competing at it. I did go to a few competitions for Northern Ireland and that, and then I just decided at 17 years old, I was like, I'm kind of over this. Like, my friends were starting to go out and whatever it may be, so I was like, oh, I think I want to go do that. I think I lasted about 6 months, and I was like, this is terrible. Like, why would anyone want to live like this? So I just started going to commercial gyms, and then CrossFit became a thing. So I did CrossFit for 6 months. I didn't know weightlifting was a sport. I'd never seen it before, because thankfully it's starting to get a lot more media attention now, but it didn't really get anything back then. So I was doing CrossFit, and a girl I did CrossFit with, she wanted to go to this weightlifting gym, but she didn't want to go on her own. So she was at me for a while, like, will you come with me? And I was like, oh, I'm really enjoying this CrossFit, like I don't really want to do that. And then I finally decided, right, I'll come with you for your first day. So off we went to this gym. And then in the first session, the coach came up to me and he was like, have you ever thought about competing in weightlifting? And I was like, what do you mean? Like, in CrossFit? And he was like, no, in weightlifting. I was like, I just looked at him like, I don't know what you're talking about. So he like explained it all to me and I was like, oh, I didn't know that was a thing. And he was like, I think you could be really good. Like, I think you could lift for Ireland, go to the Commonwealth, etc., etc. And I've done everything that he said that I would do on that first day. And I'm just naturally a very competitive person. So as soon as he said that to me, I was like, absolutely, let's go. And I just haven't looked back since.
It must have been quite the impression on your first day at the gym.
Yeah, I wasn't lifting anything crazy, like impressive, but I think you could just tell by maybe how I was moving or like maybe my attitude to learning and taking things on board. Like I don't really know, I can't speak for what he saw, but he clearly saw something and
here we are.
I jumped at the chance.